The legal drugs we take today, both over-the-counter and prescription medication, are responsible for at least 100,000 deaths per year in the United States alone. As many reports have indicated, most of the published research supporting these drugs is completely false. Results are manipulated in order to get products onto the market as quickly as possible, rather than to ensure their safety. We are now more than a decade past when the most widely accessed article in the history of the Public Library of Science (PLOS) was published, a scathing review of medical fraud, and the problem has only worsened. Medical professionals still risk their jobs and reputations to get the message out there and educate the public. Dr. Richard Horton, the current editor-in-chief of The Lancet, is just one prominent example. The case against science is straightforward. Much of the scientific literature, perhaps half, may simply be untrue. Afflicted by studies with small sample sizes, tiny effects, invalid exploratory analyses, and flagrant conflicts of interest, together with an obsession for pursuing fashionable trends of dubious importance, science has taken a turn towards darkness. This is quite concerning, particularly given the fact that most graduates coming out of medical school today are educated extensively on prescription drugs. That education, however, is based on flawed, biased, and/or outright falsified research. They are being groomed for the medical establishment by those who stand to profit the most, and it's not consumers. Unfortunately, many doctors remain entirely unaware of the deep systemic issues plaguing their profession. Dr. Peter Gottschalk, co-founder of the Cochrane Collaboration, the world's foremost body in assessing medical evidence, published a paper last year in The Lancet arguing against the use of antidepressants and explaining their dangers. It's remarkable that nobody raises an eyebrow when we kill so many of our own citizens with drugs. These deaths can be difficult to measure and report on, however, because they do not happen instantaneously, they are the result of prolonged use over a stretched-out period. Gottschalk's two main areas of focus are antidepressants and non-steroidal anti-inflammatory painkillers like ibuprofen, Tylenol, celecoxib, and diclofenac. Another is Vioxx, which was actually withdrawn after it was discovered that it had caused more than 100,000 cases of serious heart disease in the United States during the 5 years that it was on the market. According to Gottschalk, these deaths are just the tip of the iceberg when it comes to the failure of the drug regulatory process to protect patients. These terms for our drugs are invented by the drug industry. They had a huge financial interest in calling these things anti-inflammatory. It lured doctors into believing that these drugs somehow also had an effect on the disease process and reduced the joint damage.